Plantar fasciitis is a super common condition, but the way that it is treated is often misguided, and that is what we're going to talk about today. Hey everybody, I'm Dr. Kirsten Wishloff. On the podcast today, we are talking about plantar fasciitis. So when we think about plantar fasciitis, the things that come to most people's minds are orthotics, rolling a ball on your foot, maybe icing your foot, and at best for rehab, like little toe scrunches or something where you're moving your toes. This is not a comprehensive plan for the management of plantar fasciitis, and it's actually probably part of the reason why people think there is no solution for them, because they keep trying the things that are the common solutions and getting nowhere. So we're going to talk about a few different variables we want to consider when we're discussing problems with the feet in general. But more specifically, we'll chat through plantar fasciitis. So the first thing I want to bring to your guys' attention when it comes to any sort of fascial-based injury, it is very, very affected by hormone shifts. So whether that is estrogen levels, whether that is cortisol or stress levels, blood sugar levels, your hormones change the fabric of your connective tissue. So what you'll see a lot of the times when people have bilateral, so 2-foot plantar fasciitis, sometimes it will onset around the time of menopause. So when you're having a shift in estrogen levels, sometimes it will come on kind of the backside of a diagnosis of diabetes, or it'll come when your blood sugar hasn't been managed super effectively. We want to keep these things in the back of our mind because these have nothing to do with rehab. And so we can't give them an exercise-based approach at the forefront because you're not going to have that big of an impact. So if you are someone that falls into that category of hormones kind of going up and down, shifting changes within the hormone levels of your body, that's really the first layer of intervention. Yes, we can do stuff to relieve the pain in the meantime, treatment, movements, etc. But really the underlying thing that we want to get under control is the flow of hormones in your body. That's going to give us the foundation to actually rehab this tissue. Because if we're not identifying those hormonal shifts, you're really going to be chasing your tail because the actual fabric of the tissue you're trying to recover is going to inherently have problems. So the first thing you really want to address is anything disrupting your hormones so that you know that it's not going to be just a rehab-based intervention. We're going to start to include other approaches at the forefront of the intervention. Most commonly, when it's bilateral, that's going to be something that we want to keep in the back of our minds. The next thing that we want to think about when we are discussing plantar fasciitis, or again, any problem at the bottom of the foot, is how is the rest of your body moving? So when we look at what your foot is absorbing forces from, it's the rest of your body. And so your head, your rib cage, and your pelvis all move together to keep you out of pain, keep you flowing in movements that feel comfortable, and keeping you balanced. If you guys want, in the show notes, I'm going to link to a posture self-assessment guide. It's going to help you navigate this understanding of how your foot pressure is connected in with the rest of your body and how all that movement has a particular pattern that it'll take. The thing that people don't recognize is if you hurt your shoulder and you don't normalize the movement through your shoulder, that missing motion or guarding is going to flow somewhere else in your body. So you'll actually have that pain point protected. So again, I'm using the example of shoulder, but whether that's neck pain, rib injury, hip problems, any sort of injury that you haven't fully recovered from. And when I say fully recovered, I mean you can load that thing with speed and not have a problem. Not just at rest, it feels okay, but I can load that thing without any fear. If you have fear still within a body part, your body is going to guard and protect it. And you're going to have this like shape-shifting cascade that pours through the rest of your body. And so when we look at plantar fasciitis, especially unilateral on one side, there's often a cascade of compensations that's coming from another injury. Rarely is your plantar fascia the first line of injury. Generally, it's secondary to a past knee surgery, lower back injury, etc. It's usually a late stage injury because it is the last place you can compensate, essentially. So we want to keep that in the back of our mind when we're dealing with plantar fascia is we want to normalize movement through a variety of joints in the body. You don't necessarily need to have perfect mobility and perfect movement everywhere, But the way that you collect and coordinate it should have a lot of variety. As soon as you do not have a lot of variety in the way that you can generate movement, you're more likely to get these overload points. So that's something that we're thinking of as well when we're talking about plantar fasciitis, is creating a map of past injuries and making sure we're evaluating any areas your body is hesitant to load and addressing them. Hey everybody, just jumping in to let you know my 4-Day Fix program, a completely free 4-day online workshop, is just around the corner. This time we are going to be covering all things neck and shoulder. So if you are someone suffering from chronic neck pain, chronic shoulder injuries, or if you are a practitioner who works with clients and you want to clean up your methods when it comes to treating those issues, jump into my show notes and get registered for this free 4-Day Fix program. Back to the show. So those are the first kind of big picture foundational things. What's the hormone health? What's the movement health look like? What is the picture that we're drawing within our minds? Once we have a clear idea on those two things, that's going to be the start of the roadmap to navigating plantar fasciitis. The next, and I'll put a little asterisk on this one because maybe I shouldn't go at the start, but you want to make sure you are dealing with plantar fasciitis. There are many structures in the bottom of your foot, like many structures in the bottom of your foot. There are many bones, there are many joints, there are many nerves, ligaments, etc. And a lot of those structures can mimic plantar fasciitis when maybe that's not actually the problem. So as a caveat at the very start, make sure you're actually dealing with plantar fasciitis and not just calling every pain at the bottom of your foot plantar fasciitis, because it could be something else. I digress. Let's continue on. The next thing we want to think of is, if you are planning on using an orthotic or getting some sort of orthotic, is that it is a temporary strategy for pain relief. Now, there's certainly instances where an orthotic can be productive when the shape that your foot is in is not natural. And some of the things that I think of in that moment are steel-toed boots. So people who have to wear steel-toed boots for a living, it's going to structurally change the shape of your foot. So if we can put your foot in a position that actually blocks stress in the plantar fascia, it can be a productive pain relief strategy. Other professions where you are, again, doing predominantly standing through the day, that orthotic can be really productive to kind of shift where movement is happening. What we don't want is orthotics replacing rehab. So we want to actually make sure that your foot can move and that we've addressed the fundamental problem that was leading to this area being overloaded. Or else, just as I said in kind of point 2, that movement's going to be captured somewhere else. And so what you'll often see is if someone can't control their foot in the ground, they can't lift their arch, lower their arch, move their foot, control their hip, that pours up somewhere else. Oftentimes it's actually the opposing lower back from the foot that's aggravated. That's going to be the area that you're going to actually be able to leverage that foot lifting up when you're walking. So if you can't push off your foot, the opposing side of your lower back is actually going to go to take on that job. And so if we don't address the problem within your movement, that movement is going to pour somewhere else. So although an orthotic might feel really good in the short term, if we don't actually address the underlying cause of the problem, that's going to shift somewhere else in your body. So pain is an indicator of where force is accumulating in your body, but the lack of pain doesn't necessarily mean that you fully recovered the problem. It doesn't mean that it's solved. It means that we've blocked the overload from happening. Until we redistribute force to that area and teach your brain how to control it, it's going to be even more susceptible to injury if you go with that strategy. So it's something to consider when we're looking at the use of orthotics. Is, are we using them in a productive way that's feeding into an improvement in the long term, or are we just using them to block the pain sensation, block the movements that are painful? We want to make sure that we're really clear on the purpose of those orthotics for whatever condition specifically you have going on. This leads me to my last kind of point of discussion for the big kind of barrels we want to look at when we're talking about plantar fascia pain. And the last is your big toe. So there's actually a biomechanical mechanism called the windlass mechanism that happens in your foot during the gait cycle. So when you are walking or running or moving, your big toe actually plays a really critical role in how tension is wound up and utilized in your plantar fascia. If you are someone who is missing big toe movement, if you have bunions, if you have any dysfunction in the big toe itself, it's going to fundamentally change how structures communicate with your plantar fascia. So it's going to fundamentally change how the plantar fascia is loaded. And so that's really going to be a big part of addressing the rehab is, can we change the position and the control of the big toe? And can we influence that coming into that plantar fascia movement? So the big toe is actually a really, really important piece when it comes to recovering from a plantar fascia injury. And it is often overlooked. So then that kind of leads us to like, how do you rehab plantar fascia then? You're like, okay, so you brought up some things. How do you do it then? You want to be thinking that it's not a plantar fascia protocol. It is a movement diversity protocol. So when we're trying to solve an injury in a person, it actually has a lot more to do with the person and the stresses that their body undergoes than the injury. And I think that's sometimes where the system gets it wrong. It's tough because you have to categorize things to learn about them, to understand it, to even start to have a framework on how to manage them. But the reality is one person's plantar fascia injury could be entirely different from another person's. And so we can't go at it with exercises specific to the plantar fascia. We have to go at it from exercises specific to movement distribution in the body. Once again, I'll remind you guys, if you look in the link of the show notes, I'm going to give you just a free little assessment guide. It's going to show you how movement couples in your body so that you start to get a sense of how one thing can lead to a cascading of events somewhere else in the body. But the summary of what I would say is regaining control of the midfoot, so where your arch actually is, being able to rotate in your foot is really step number one. It's far more important to have that than strength in your tippy toes for a few reasons. But the biggest reason is the muscles that are actually responsible for dropping your arch down and picking it up are vastly stronger and have much better leverage than the toe scrunching muscles. And so when we're looking at what is a better strategy to manage these forces, we want to be looking at really high leverage muscles to do a big job, not little teeny tiny stabilizing muscles in that context. The purpose of the teeny tiny stabilizing muscles is then trained out in coordination and sequencing. Small muscles give subtle changes, and the faster you can collect and coordinate in those small teeny tiny muscles, the less likely you are to get overloaded, because the rate with which you can get everything into action is much quicker and more organized. So when we're talking about rehab for the plantar fascia, arch up and down is the big strength stuff we want to be doing. And then work within the toes is really a speed thing. How do you coordinate? How do you collect? How do you get balance? How do you push off? This is what we want to be thinking about with toes, not necessarily just totally exhausting the musculature on the bottom side of your foot. That's not going to be a super productive long-term solution. As I had mentioned previously, we want to take that full body approach. So those are specific to the actual movement of the foot. But of course, in every instance, we want to be looking at the hips, lower back, thoracic spine, shoulders. How is everything up the chain distributing force? And start to take down the biggest imbalances and start to align them. It's not about more motion. It's about the way that you collect and distribute motion and how quickly you can coordinate that. So once we start to get a sense of the areas missing motion and coordination, that's really what we're going to lean into. And then from there, it's these small tweaks depending on what you're trying to get back to. The more niche or more specific that you're trying to get back to, the further down that recovery line you have to go to put yourself in a position to build up enough strength to hit that tolerance. But if you're just looking to get back to life and walking and hiking and things like that, really the process, if you are navigating in the right direction, you should really start to see positive improvements within a month or two. If you're not seeing positive improvements within a month or two, it means the strategy that you're using isn't effective. And it doesn't mean that it has to be completely healed, but there should be some sort of notable progress, notable changes. If you are someone who has been dealing with plantar fascia for a really, really long time, or you have clients who have been dealing with plantar fasciitis, you give yourself a month or two. And if it's not progressing, we want to be changing the path that we're taking to navigate that injury. If you're a practitioner and you're listening to this and you're doing toe scrunchies and you're doing the rolling and the rubbing of the foot really hard, chances are you're probably not getting a lot of results. And that's because you're not understanding the mechanism of really what's happening. And if you're a client that's trying to navigate it, most of the time people really get off the deep end with self-massage techniques on the bottom of the foot. Strength and coordination is the long-term change that you need. And again, it's not just isolated into the foot. It's the foot sequencing up with the leg and the hip and the knee and the torso. It's how everything is coordinating and distributing in your body. Start with the big pieces, then drop down to the small ones. That is all I have today for that little topic of plantar fasciitis. If you are someone with plantar fasciitis, please again reach out. If you want to learn more about how we manage this within my programs, join the waitlist for the Posture Revival. We are absolutely covering all things feet within that program and educating you on how those feet are impacting the rest of the system. Thanks for tuning in. I'm Dr. Wishloff. I look forward to seeing you next week.
Once again.